I welcome everyone in this case discussion, which is an index case in terms of quantum of compensation and a very, very high profile case in which as many as 29 doctors were implicated in the case cited as Dr. Malay Kumar Ganguly versus Dr. Sukumar Mukherjee and others. The case attains significance because a number of questions were put before various stages of law, from the Judicial Magistrate Court in Calcutta to High Court of Calcutta, and then up to the Supreme Court. And things were adjudicated in the way the legal system sees professional negligence vis-a-vis the criminal liability. Before we start our discussion today, it would be pertinent for us to understand who are the parties to the suit. When I say parties to the suit, that means who are the litigants, that is, who is the petitioner, who is the respondent or defendant, and so on. In this case, Dr. Malay Kumar Ganguly was brother-in-law of Dr. Kunal Saha, who is the principal litigant. He has filed this appeal against Dr. Sukumar Mukherjee, Amri Hospital, Calcutta, Dr. Vaidyanath Haldar, Dr. Abni Roy Chaudhary, and others. They are the respondents. With this background, we start. We're just holding it for a bit.
Just check audio.
Kindly check the audio. Am I audible? Okay. So in today's discussion, we will narrate the events as it unfolded on the following heads. But at the outset, I would like to intimate or sensitize this August gathering on few facts. The fact number one, the question number one is whether a misdiagnosis or a wrong diagnosis per se constitute medical negligence. Two, a particular line of treatment, modality of treatment advised or administered by a practicing doctor in a hospital would also make the hospital liable in terms of deficiency in service. Three, whether contributory negligence can be taken, and if taken, to what extent can be relied upon by the responding party, that is the doctors and the hospital, to acquit themselves from the case. Fourthly, whereas a collective error by a group of doctors be treated as a criminal negligence, or it can be a negligence in the realm of law of tort. And lastly, but not least, what would be the parameters to decide or differentiate criminal negligence liability from that of a civil negligence? With these, we go on with our discussion of today. As I stated, there is a high-profile case in which Dr. Kunal Saha and his wife, Mrs. Anuradha Saha, landed up in India on 24th of March at their own residence in Kolkata. Via Delhi, they reached Kolkata, and they landed in Kolkata on 1st April 1998. At this juncture, it would be relevant to know their status. Dr. Kunal Saha is a scientist and is a practicing scientist since last about 25 years in Ohio, USA. He is dealing with genetics and other things. His wife, Dr. Anuradha Saha, was a child psychologist and an eminent personality. She was also working at her own employment. And therefore, after landing in Kolkata on 1st April, on 26th April, Dr. Anuradha Saha complained of fever and some rashes in the body. She was consulted, and Dr. Mukherjee came to their parental residence and examined her and advised her rest, reassured her, but did not prescribe any medicine and said that this rash and fever will go on its own. However, on 7th May, that is almost 2 weeks later, the symptoms reappeared and she developed extensive rashes. Then she was taken to Dr. Mukherjee's clinic, wherein Dr. Mukherjee prescribed intramuscular injection Depomedrol 80 milligram twice daily for 3 days. This being the entire bone of contention, we must remember this dosage and the medicine till the end of this discussion. However, the conditions did not improve at all. Rather, it worsened day by day. And on 11th May, Mrs. Saha developed rashes all over the body and was admitted in the Advanced Medicare Research Institute Hospital in Kolkata, or popularly known as Amri Hospital, under Dr. Mukherjee's supervision. Along with that, there is certain extensive skin erosion in the body, for which she was also put on oral Voisolone. However, as per documents available on record, no supportive therapy was prescribed at that stage. On the second day, that is on 16th, Dr. Vaidyanath Haldar, who is a doctor at Amri Hospital, was consulted, and he found the patient to be suffering from TEN, or toxic epidermal necrolysis. It would be relevant to state that when the patient was referred to Dr. Sukumar Mukherjee, he found the patient to be suffering from allergic vasculitis, erythema, and some blisters. He put that as differential diagnosis as angioneurotic edema and prescribed the steroids systemically. However, Dr. Vaidyanath Haldar, himself being one of the leading doctors in Amri, differed from the diagnosis and diagnosed the patient as toxic epidermal necrolysis, because probably by that time had already had a 25% to 35% loss of her skin, including oral ulceration, perioral ulceration, and complete denudation of skin from the tongue. Later on, Dr. Abni Roy Chaudhary, who was not actually a doctor in Amri, was consulted, though that is not from the hospital side, but from the personal request of Dr. Vaidyanath Haldar. Dr. Abni Roy Chaudhary was an eminent dermatologist and written many books in Kolkata. And few friends of Dr. Kunal Saha also took part in the modality of treatment. Dr. Abni Roy Chaudhary did not mention any particular or change any prescription or wrote any prescription. And despite Dr. Vaidyanath Haldar having differed in the diagnosis, the prescription of Depomedrol and Voisolone continued without any evidence of any supportive therapy in terms of given intravenous fluid, enteral nutrition when the patient is actually cannot take anything per orally, hydrogel or other occlusive dressings, infection control, eye control, mucosal hygiene, as well as other things in terms of maintaining a particular temperature in the room. Nothing was actually prescribed. The condition of the patient kept deteriorating, and at the insistence of her husband, she was shifted to Bridge Candy Hospital, Mumbai. At this stage, it would be pertinent to note that neither Amri Hospital nor Bridge Candy at that point of time had a specific burn ward. There was no burns ward available in either of the hospitals. And even in Bridge Candy Hospital, the patient was referred to a plastic or reconstructive surgeon and not to a dermatologist. One of the doctors, who was respondent number 5, Dr. Prasad, Balram Prasad, wrote the transfer in which allegedly he had written, for better treatment, the patient is shifted to Bridge Candy. This is important for us because this is also another bone of contention which will unfold as we go ahead with the presentation. When the patient reached Bridge Candy, she was received by Dr. Farooq Udvadian, and he noticed that there is no skin left in her entire body except the scalp. She has lost all her skin cover. And also he noticed some greenish discoloration on the back, on her back, indicating severe bacterial infection. The same modality of treatment was continued. However, in a tapered dose, the depomedrol was reduced and it was stopped. Supportive therapy was administered. However, nothing came to her aid. And finally, Mrs. Saha, at a very tender age of 38 years, succumbed to her disease and breathed her last on 28 May 1998. Aggrieved by the same, criminal complaint was filed before Chief Judicial Magistrate Alipur, and a complaint on National Consumer Dispute Redressal Commission was filed by Dr. Malay Ganguly as well as Dr. Kunal Saha. Concurrently, Dr. Kunal Saha also raised complaint against professional malpractice against these doctors before West Bengal Medical Council. The National Commission held the doctors of Amri Hospital to be negligent and awarded a compensation of 1 crore 55 lakhs and so on. West Bengal Medical Council acquitted all doctors of any professional malpractice. Whereas, surprisingly or interestingly, in the criminal court held the doctors to be liable other than Dr. Abani Rai Chaudhary. They had awarded a simple imprisonment of 3 months to both Dr. Sukumar Mukherjee as well as to Dr. Vaidyanath Haldar, and also charged a penalty of 3,000 rupees against both of them, failing which they also awarded an additional imprisonment of 15 days for both of them. Therefore, doctors were aggrieved, the hospital was aggrieved by this order. On the other hand, the complainants, Dr. Malay Kumar Ganguly and Dr. Kunal Saha, was aggrieved by the very less compensation that was awarded by the tribunal, and hence the matter was referred to Calcutta High Court. Calcutta High Court withdrew the petitions lying before the Judicial Magistrate Court and National Commission and decided on the matter in the favor of the doctors and the Amri Hospital. They not only acquitted the doctors of any liability, but also made certain scathing remarks against certain expert opinions made by doctors from abroad, from USA, as they did not depose before the court, nor they were examined, and that the National Commission relied upon such unadmissible evidence, as well as they felt that the transfer document of Mrs. Saha from Amri Hospital to Bridge Candy was interpolated by Dr. Kunal Saha. Based on this, am I audible? Is my voice clear?
Yes, sir.
Yeah, okay, thanks. So based on these facts and aggrieved by the fact that the High Court has exonerated these doctors, the appeal to the Apex Court was preferred. When the matter came before the Apex Court, the issues brought by the petitioners were as such: criminal negligence complaint under the Chief Judicial Magistrate under section 304 alpha of Indian Penal Code in terms of res ipsa loquitur were pleaded by the petitioners. They also relied upon the ground that respondent number 1 here is Dr. Sukumar Mukherjee, stating that his diagnosis of angioneurotic edema with allergic vasculitis was wrong. A wrong diagnosis also compounded by the fact that she was never referred to a dermatologist. The doctor made a wrong diagnosis and persisted with it. Second point that is relied upon by injection dipomedrol 80 mg BD IM for 10 was wrong. But the dose is excessive and the drug itself is never prescribed in any literature. Also, they relied upon the fact that the treating physician completely failed to adhere to the treatment protocol given in various references, especially in book of the drug practices of dermatology by Fitzgerald, and those references were shown. Also, it was brought out before the court that small vessel vasculitis has a different etiology altogether, of which allergic vasculitis is one. Here, the cause or trigger is actually immune response, especially against in rheumatoid arthritis. Rather, it is actually not an allergic reaction, but it's actually a leukocytoclastic reaction, resulting in erosion of large surface area of the skin, for which steroid is never prescribed. And this was the very basis of the litigation. Further to this, the petitioners also stated that no remedial measure was taken by Amri Hospital, even after realizing that huge amount of long-acting steroid was actually given to her. As we all understand that dipomedrol is methylprednisolone acetate, which is a long-acting drug, stays in the body for a very long time, and never generally prescribed for acute conditions. It is generally prescribed for chronic conditions, and that too in a much more different dose, like maybe one injection in 2 weeks. Whereas in this case, dipomedrol 80 mg was prescribed twice daily for 3 days, and later on also continued both, although in a tapered dose. That was one of the main plea of negligence. Also, they stated that R3, R4, that is Dr. Haldar, as well as Abni Roy Chaudhary, as well as the Amri Hospital, did not intervene, rather added more fuel to the fire by prescribing injection prednisolone along with it. And therefore, a state of very high volume of steroid, resulting in a negative feedback to the hypothalamo-pituitary adrenal axis took place. Not only that, patient's immunosystem was compromised and she was made to be more prone to nosocomial infections. With all this, a compensation claim of whooping almost 78 crore with interest was alleged against various respondents. On the other hand, respondents from their side defended their case by stating that there had been no malpraxis, as West Bengal Medical Council, the expert body, itself exonerated them. And there was as such no malafide intention or mens rea found while treating the patient. And therefore, operability of section 304 alpha of Indian Penal Code is not there. They also relied upon contributory negligence of Dr. Kunal Saha, as they stated that Kunal Saha continuously misled the doctors on various drugs, treatment modalities, as well as did not allow any nursing care. When a special ICU room was separately earmarked for the patient, he did not allow anybody to enter, including doctors. He did not allow dressings to be done. he did not allow changing of the dressing, to the extent that one of the doctors of Armory deposed that on the day when the patient was finally shifted to Bridge Candy, he forced his way to change the dressing and made new dressings. A few medicines were purchased which was not prescribed by them. Actually, the joint prescription made by respondent number 2 and respondent number 3 in this case was actually written down by the hand under the hands of Dr. Kunal himself. The pathological report requested by respondent number 1, that is Dr. Sukumar Mukherjee, was never shown to him. Also, there lies no evidence that respondent number 2, that is Dr. Baidyanath Haldar, and respondent number 3, that is Abani Roy Chaudhary, were ever together and discussed the case and treated them. The joint prescription, as I stated earlier, was noted down and written under the handwriting of Dr. Kunal himself. It was actually a self-serving document. The post-mortem examination never stated that the patient died of toxic epidermal necrolysis. So therefore, the cause of death either is natural, it may be homicidal or suicidal also, but the doctors and the Armory Hospital no way can be blamed for that. And also they stated that they are not amenable to consumer court as the accused doctors did not charge any fees as a matter of relevance. So therefore, the legal issues before the court was whether the respondents were guilty of criminal negligence of the Indian Penal Code at all or not. I would take one point, each point one by one, so that we are clear and we don't leave it to the last to discuss. The court deliberated on what would constitute a civil wrong or civil negligence vis-a-vis that of a criminal negligence. When it came to civil negligence, the law of tort would apply. Law of tort, the negligence is defined as breach of a duty of care which has happened because of omission done by a person, guided by those considerations of human transactions which otherwise anyone of due prudence would not have done, or he has done something which the other person normally would not have done so. Meaning thereby, a person of a particular competence would not have omitted doing so, which a person charged with negligence have omitted, or would have done something or would not have done something which a person charged under tort has done, has committed. Whereas, when it comes to criminal negligence, the responsibility is much more heavier. Heavier in the sense that there has to be a guilty mind associated with it. The doctor must be aware that such a procedure, such a therapy, such a treatment would have caused death of the patient, and yet without due precaution or due expertise, he did so. That is the basic difference of framing a criminal negligence against a doctor and a civil negligence. The burden of proof, the degree of criminality or proportion would be much higher in criminal negligence. Now, next question that came, whether the respondents are liable to pay compensation to the appellant in terms of the provision of Consumer Protection Act. It was decided that whether the doctors have charged any sum of money or not, the patient or the parties of the patient did pay hospital bills. So therefore, consumer courts are fully competent to deal with the matter. However, later, for calculating of correct compensation, the matter was reverted back to consumer court. That I'll come later. Third point that was before the court was whether the claimant is accountable for contributory negligence. There is a very, very important question. 2 or 3 doctors spoke and clearly stated that Dr. Kunal Saha was extremely interfering, very, very arrogant. It was seconded by doctors of Amri Hospital, or Bridge Candy Hospital, when Dr. Farooq has clearly stated that the brother of Dr. Kunal Saha came with quinolones and forced him to give quinolone to the patient when it actually did not matter. Patient was in a terminal stage. Also, they insisted upon whole blood transfusion, which Dr. Farooq completely resisted. Later on, he somehow considered injecting erythropoietin, which he also felt that is of not much of a use at this stage. Similarly, use of zinc. However, under pressure from the patient side, he also succumbed and decided that at least administration of these medicines would not do any further harm to the patient. So what's wrong in trying that? Also, there are certain antifungals administered to the patient which is out of prescription. In that case, the matron of the hospital was examined by the court and she was asked, her name was Sutapa Chanda, she was asked that was this prescription made by Dr. Kunal Saha or by the hospital? To which she answered that had this prescription made by the hospital and she has not understood the prescription, she would have referred back to the hospital. As Dr. Kunal Saha prescribed this antifungal and she was not given any opportunity to check whether this would be given or which dose would be have to be given to the patient, she said that this is not her domain to comment upon. After hearing all this, Supreme Court lamented that how a hospital can be made to go scot-free, alleging this as a contributory negligence. Why did they succumb to the requests or suggestions of the patient? A professional hospital, a professional doctor would be fully liable and would have refused the patient on that ground. Having treated them, and that is in nowhere in record did this was mentioned that these are given at the insistence of Dr. Kunal Saha. Such allegation of contributory negligence did not hold any water. The next issue is whether claim of enhancement of compensation justified. The National Forum, in a simpliciter ruling, calculated the basic pay and the DA of the deceased and gave a 13% multiplier and calculated the compensation. Supreme Court denounced such calculation, as we will discuss later as we see the particular viewpoint. And therefore, the compensation was raised. On what ground compensation was raised, that we will discuss later. Whether the claimant entitled to pecuniary damage under the head of loss of employment, loss of his property, traveling expenses, though he could not convincingly prove that her wife, the deceased, was employed gainfully. However, the fact that he has lost opportunity to serve and work, had to travel many times as the case took 5 years to be decided, paid money for the air ambulance to the tune of 2 lakh rupees for transferring the patient from Kolkata to Mumbai. Also, a loss of consortium, the pain and agony that he has gone through. All this entitled him to pecuniary damage over and above the compensation that he has claimed. Now, whether he was entitled to interest, simpliciter rule, court agreed to interest of 18.5% as decided by Calcutta High Court initially. Another reasoning, first question that arises, cumulative medical negligence on the part of the treating doctors, would that amount to liability under joint and several liability head? The answer was resounding yes. Now, where did the negligence lie? Was the negligence because of wrong diagnosis? Or was the negligence because of wrong modality of treatment? The court said it is both. The literature as well as deposition of experts clearly indicated that steroids are not preferred line of treatment. Here, Supreme Court examined and classified 2 sets of experts. One, anti-steroid, second group, pro-steroid. The anti-steroid group, especially Canadian and US doctors, categorically stated that there is no role of any long-acting steroid in the case of 10. That is to be given. It is absolute no. It's not to be. Whereas doctors in India say that they do give 10, they do give steroid preparation to a patient suffering from 10. However, the dose is very little and it's a tapered dose. And also a short acting or ultra short acting salt of the steroid is always preferred, not depomedrol, which is methyl prednisolone acetate, a very long acting drug. That is point number one. Second, question came how AMRI could be held responsible for a treatment modality prescribed by the doctor. From the hospital side, it was projected that the patient knew all along that AMRI does not have a burn sword. And the patient, a separate ICU room was here for the patient. The relatives of the patient did not let anybody in. And therefore, they should be absolved of any deficiency of service. However, the court held otherwise. They stated that the deficiency of service was in terms that they did not prevent or raise this objection with the patient, put this on matter of record, or refuse the patient when their protocol was breached, when their nursing staff was not allowed to do the nursing, their dermatologists and other doctors were not allowed to treat the patient. Actually, it was found that there had been no dressing whatsoever ever conducted in AMRI. The dressing of the wounds were first started at the Bridge County Hospital. The Pseudomonas infection, which gave the greenish discoloration of the skin, court held, must not have happened in one day. They did not feel that East-West air ambulance service was bad. However, the question whether she was given an IV fluid or she was given occlusive sterile dressings remained in question. Court did not want to go into that field as nobody really challenged the air evacuation process. So therefore, it was held that proper guidelines of professional care were not followed by doctors and prescribed dosage was not followed by doctors, even if their wrong diagnosis, if for the sake of argument is taken as correct, still the dosage followed by the doctor was against the practiced norm. However, since no intention of causing harm was proved, the respondents could not be convicted for criminal charges. As a result, Dr. Sukumar Mukherjee, Dr. Vaidyanath Haldar, Dr. Abani Rai Chaudhary, AMRI Hospital, Dr. Balram Prasad, all were held responsible for medical negligence, resulting in death of Mrs. Anuradha Saha. In the civil appeal, Supreme Court remitted back the case to NCDRC for calculation of compensation correctly. The final award was about 12 crore rupees in different breakdown. It was broken down in terms of loss of remuneration of the patient, loss to her husband, agony, mental torture, loss of consortium, expenditure in court case, expenditure in hospital, expenditure in transferring the patient. Everything was taken into consideration. And a compensation money of 6 crore was decided and a penalty of 5.5 crore almost was levied on the hospital and the doctors. AMRI held vicariously responsible for its doctors. The Supreme Court made a decent note against the Kolkata High Court judgment, in which Kolkata High Court held that there had been medical negligence cases galore in West. So the doctors opining therefrom are no holy cows. They have not deposed before the court. They have not been examined by any of the parties. They could not be examined under oath, to which Supreme Court said that they could have been easily examined under video conferencing. So such allegations, also allegations that the transfer note was interpolated by Dr. Kunal Saha was never found to be correct. And in fact, Dr. Balram Prasad himself has agreed that this note was written by him under his own hand. Therefore, the High Court should not have made such statements. Notwithstanding that, as a conclusion, I would like to say that this is in India a first case with such a high quantum of compensation. The case swung from one side to the other. Once doctors were found criminally liable, then they were acquitted. A very low compensation money was given, which was later on raised. What was highlighted was quality healthcare cannot be substituted by low effort healthcare. This is the bottom line. Nobody really questioned the treating physicians, even if they made a wrong diagnosis or given a incorrect modality of treatment. Repeatedly, doctors saw the patient. Nobody really intervened with the treatment. It was kind of, the patient was kind of made a fait accompli, which resulted in a very, very shoddy outcome of the case. There was no doubt that a wrong diagnosis per se is not a negligence. Accident is not per se a negligence. A treatment which is just varied from the established kind of treatment should not be interpreted as deviation. But doctors who are claiming a particular position in practicing their profession as specialists to that particular ailment or disease process has inherent right, and there is obviously a legitimate expectation of the patient when they come before the doctor. Whereas it was taken by the respondent doctors that toxic epidermal necrosis, the fatality rate is very high, from 40 to 70%, to which the court said, if the fatality rate is so high, then what special did the doctor bring in? They did not even prescribe the basic supportive treatment. Despite that, no criminal negligence liability was casted on them. So far as res ipsa loquitur is concerned, the inference of guilt would not be proved, obviously. So, though there were no determinative tendency, unerringly proving towards the guilt, and therefore these doctors were not made responsible under res ipsa and were acquitted of their criminal liabilities. Now, therefore, what would be the preventive measures? Time and again, record keeping came into the forefront in discussion. Whereas the hospital said, and probably correctly, because many doctors stated that Dr. Kunal Saha made n number of telephone calls, interfered in every possible way, used his own prescription, brought in his own medicines. Both the hospitals, Amri as well as Bridge Candy, stated that. But unfortunately, nowhere it was found recorded. So therefore, in a court of law, when one is pitted against the other, this was the question that was relevant to the court. Also, when medical negligence case came up, the doctors started blaming each other. Respondent number 2, that is Vaidyanath Haldar, said that since Sukumar Mukherjee is a senior doctor, his prescription continued. Sukumar Mukherjee said that I had left Kolkata for USA on 11, so my prescription would be valid only till 11, not afterwards. Dr. Prasad said that he is prescribed different medicines, but that was not acceded to. So they fell apart. Record keeping, cohesion, appropriate briefing, and more so, an appropriate following of the standard treatment protocol could have probably saved the case for the hospital and the doctors. Also, the fact that rigorous infection control measures were not taken to minimize nosocomial infection, hospital was also found deficient in their service. So I would finish my discussion here. Should there be any question, I will be ready to answer.
Sir, fluoroquinolone itself is a precipitating factor for 10. So in that case, how come a fluoroquinolone was prescribed, sir?
It was not prescribed. Actually, quinolones at that time in 1998 was probably a new drug to India. And Dr. Kunal Shah's brother, who was in US, he got those quinolones and insisted that they be given, probably to prevent the superinfection. And actually, the trigger for 10 was never being questioned, or nobody, in fact, court also did not go into the nuances as to how did it cause. The patient was known case of sensitive to Chinese food, which she took, whether it was a viral event that triggered the particular disease or ailment of 10 was actually under doubt. Any more questions, please? Any comments also would be most welcome. Okay, two questions have come on chat. First one I would take. It is any such high amount compensation in other cases later? Not after that. Till date, though in Consumer Protection Act 2019, there had been a quantum leap in their pecuniary jurisdiction. That means they can go up to more than 1 crore NCDRC. However, no such case has been reported so far that such high compensation was given. That is one. Second question from Rajendra Prasad. That is, did Medical Council give clean sheet? Yes. West Bengal Medical Council quite categorically stated that there had been no malpractice. Next question that came of Bhaskar Jyoti is that how the compensation was calculated. I have stated in my presentation the calculation of compensation was they have given a breakdown of compensation. For litigation cost, they have shown that it's about 5 crore. Then the traveling expenditure, some lakhs, and so on. They calculated that, and then with a multiplier factor of 13 as determined by Calcutta High Court was kept, and a multiplier method was used. Also, interest of 18.5% was levied, and that is how the compensation was claimed. Most of the compensation was to be paid by the hospital as directed by Supreme Court. I think there was another question.
Sir, this compensation matrix is given very well on the indianqanun.org, sir.
Yes, it is given, but then I didn't want to quote everything because it was not complete. It was half given over there. Now, their calculation comes only up to 6 crore, some lakhs.
Yes, sir. It's 6 crore, sir.
Plus was given. That is why I didn't want to quote. Another question, Mukesh Yadav, 2 to 3 cases where more than 1 crore compensation allowed by Supreme Court. Okay, Nizam Institute, actually, these are different cases. Compensation of 11 crore or 12 crore was given by Supreme Court. When it was asked that whether similar compensation was granted, that is why I said no. Up to 1 crore in today's parlance may not be very high. That's why I did not quote. And in any case, Nizam Institute is a different case altogether. Any more questions, sir, please? The question came from Shaurya is that where the license of the doctors cancelled if no. Okay, no. So listen, license of doctor would be cancelled if there is a criminal liability against them, Shaurya. When there is no criminal liability, it is just probably a wrong diagnosis. Probably. That was also not proved beyond doubt. So whether it was therefore there is no criminal liability and there is no question of doctors being, their license being revoked in any case. Any question more? If there is no question, that we would conclude today's session. If any question, kindly get me. Praveen, I've just received a message that to pay the amount of 11. May I have it again, please? Yes, I got the point. 11 crore doctors are not paying. Actually, doctors landed up paying only a few lakhs. Most of the amount were to be borne by Amri Hospital. That was the judgment. Okay, in this, what happens is that along with this, the professional indemnity insurance comes into play. All the doctors in civil are nowadays insured, either from the hospital side by default or by themselves. So therefore, generally, in fact, even in this case, New India Insurance was a party, and the compensation money was almost levied to the extent they were liable to pay. That was also. So actually, doctor need not to go run around and commit suicide. I side with you and share the pain, being my doctor myself, but it really not required. In fact, it is always advisable. I mean, if I just can take this opportunity to have two insurances, please, from the same company. One of the tune of, say, 25-30 lakhs, and one of the tune of 80 lakhs to 1 crore. Now, don't quote me, but what happens is that whenever there is a medical negligence issue, concerned doctor's insurance provider would be there. At that time, the doctor should just state that he has got an insurance of 25 lakhs or 30. Accordingly, court would be considering that the liability would be too much on the doctor and the compensation would be relatively less. But if the compensation amount is higher than the insurance, then he can bring in the next insurance, stating that due to typographical error, he forgot to mention. And since the insurance provider lawyer would also be a party to the suit, they can't say that they did not represent. So this is how doctor can save their skin. Any more questions? We have another. So, take home message for doctors. Yes. Very, very important, sir. In fact, really, this should be coming from you. But what I feel as interface between law and medical practice is that, first of all, have your documents straight. 1. 2, no one should try to take a patient or treat a patient which is not in your specialty. 3, whenever there should be a mid-course correction, which was never done in this case. Some treatment was initially instituted and that was continuously followed. And lastly, the standard protocol should not be deviated and records should be maintained meticulously, even negative records, like interference of patient, interference from political parties, and so on. But that would save the day for the doctors. Individual doctors, what to do, if you can elaborate. Okay, does doctor have a right to stop treatment if relatives interfere? Yes, absolutely, but it has to be documented with the witnesses signing the statement. Doctor may refuse treatment. If there is no more question, then we will conclude today's session. Okay, if there is some more questions, I'm ready to take. Thank you so much. Thank you so much. We'll call it a day. Should be able to see you soon. In the next session, after the week, on 30th of January, the program would be given to you with another new set of questions and new set of cases. Thank you so much. Have a nice day.